Okay. So, good day everyone. My name is Ivan Costales from BSN1C, and today I'm going to provide the range of motion exercise to my patient. So, in this exercise, no special equipment or supplies are necessarily to perform, and ROM exercises. And if appropriate, non-sterile gloves and other or PPE should be worn. So first is the implementation. Implementation. Review the physician's order and nursing plan of care for the patient activity and identify any movement limitations. And next is perform hand hygiene and put on PPEs if indicated. So next, introduce yourself and identify the patient's identity and explain the procedure to the patient. So, good morning sir. Ako po si Ivan Costales and ako po yung magiging nurse niyo for today. So, ano pong name mo sir?
Anyone A Costales po.
So, yung gagawin lang po natin ngayon sir is mag-provide lang po ako ng exercise sa'yo. Is that right sir? So next, close the curtains around the bed and close the doors to the room, and place the bed at an appropriate and comfortable working height, and usually elbow height of the nurse. And next is um, adjust the head of the bed to a flat position or as low as the patients can tolerate, and stand on the side of the bed where the joints are to be exercised, and lower side rail on the side if in place, uncover only the limb of the used during the exercise. So perform the exercise slowly and gently, and providing support by holding the areas proximal and distal to the joint, and repeat each exercise 2 to 5 times, and moving each joint in a smooth and rhythmic manner, and stop movement if the patient complains of pain or if you meet resistance. So while performing the exercises, begin at the head and move down on one side of the body at a time, and encourage the patient to do as many of these exercises by him or herself as possible. So first is move the chin down to the rest on the chest and return the head to a normal upright position. And next is tilt the head as far as possible toward each shoulder. So sir, yung gagawin po naman natin is yung chin po kayo yung sa neutral position. Kasi sa po. Tapos, next naman po is yung paside po. Side to side. Natural. Tapos, neutral po. Tapos, sa isa naman po. Yan. Neutral. At sa isa naman po. Thank you po. And next is move the head from side to side and bringing the chin toward each shoulder. So sir, tingin po kayo sa right side niyo na po. Then neutral. Then tingin naman po kayo sa left side. Then neutral po. At ulitin lang po natin. Sa right side. And sa left side. Okay. So next, start with the arm at the patient side and lift the arm forward to above the head, and return the arm to the starting position at the side of the body. So sir, ito lang po yung gagawin natin. So sir, task po natin yung gagawin natin hanggang sa tulog. Tapos nandito na naman po. At isa po po sir. And the next one is with the arm back at the patient's side, move the arm laterally to an upright position above the head, and then return it to the original position. And sir, next naman po is yung kamay niyo po, is papaside niyo na po. Yan, sir. So, neutral position to left. Isa pa po. Isa. Ano? Okay, sir. And after that, move the arm across the body as far as possible. And raise the arm at the side until the upper arm is in line with the shoulder. And bend the elbow at a 90 degrees angle and move the forearm upward and downward, then return the arm to the side. Yung next naman, teacher, ito po naman natin is hindi mo naman ito sa extension. Neutral position po. And next is bend the elbow and move the lower arm and hand upward toward the shoulder. And return the lower arm and hand to the original position while straightening the elbow. So, meron kami pala sir, yung isa. Is i-bend po natin yung elbow. Then, i-aangat natin. Then yung isang ganito. So, ito pong kamay natin is nahawakan lang po natin yung shoulder natin. So, one, neutral. So, pag-iwalik na lang po, sir. Thank you, sir. And next is rotate the lower arm and the hand so the palm is up. And rotate the arm and the hand so the palm of the hand is down. So, next naman po is i-rotate lang po natin, sir. The natural position po. Just pababa naman po. Susulitin lang po natin ng neutral, taas, neutral, and baba. Okay, sir. Thank you po. And next, move the hand downward toward the inner aspect of the forearm, and return the hand to a neutral position even with the forearm. Then move the dorsal portion of the hand backward as far as possible. Again, move the hand downward and toward the inner aspect of the forearm. Sir, dito po, ibababa lang po. Tapos yung papatas naman. Reach ko lang. Sa neutral, yung pababa po. And neutral po ulit, yung pataas. So, okay. Then next, bend the okay. The next is bend the fingers to make a fist, and then bend the fingers to make a fist, and then straighten them out. Spread the fingers apart and return them back together, and touch the thumb to each finger on the hand. Okay, so close, para close open natin. Tapos, yung gagawin nyo naman po, sa gagawin nyo gusto, ipa-touch nyo po yung mabalik mo po. Gawin sa po. Gawin sa mga po. Ulit na ako. 1, 2, 3. Thank you po. So, next is in the legs. Extend the leg and lift it upward and return the leg to the original position beside the other leg. So, sir, sa legs na. So, the next one is lift the leg laterally away from the patient's body and return the leg back toward the other leg and try to extend it beyond the midline.
So, yung next naman po sir is palayo po. Neutral. Then sa dorsal naman po. Isa po po sir. 1. Then sa other side naman po sir. So, okay po.
So next, turn the foot and leg toward the other side, the other leg to rotate it internally, and turn the foot and leg outward away from the other leg to rotate it externally.
So, sir, i-rotate lang po. 1, 2, 3, 4. 1. Neutral. Then palabas naman po. Neutral. So, ulit po sir, sa kabila. 1. Neutral. Neutral. Okay.
So next is bend the leg and bring the heel toward the back of the leg and return the leg to a straight position.
So, next naman po sir is i-bend lang po natin. 2. Isa pa po sir. 1.
So the next one, at the ankle, move the foot up and back until the toes are upright, and move the foot with the last pointing downward. So,
The ankles. Okay, sir. Ito pong po natin, sir, is itataas po natin sa mga sir. Okay? 1, 2, 3, go. Up. Then, neutral po. Sa gitna lang po. Neutral, relax. Then, ibababa po natin siya. So, then, neutral. Isa pa po, sir. Neutral. Neutral.
okay. And the next one is turn the side of the foot toward the midline and turn the sole of the foot outward.
So, tapos ito naman po. Papa-side lang po natin siya. Yan. Neutral. Outside. Yan. Isa pa po, sir. Yan. Okay lang po ba, sir?
So next, curl the toes downward and then straighten them out and spread the toes apart and bring them together.
Okay, sir. Ito naman po. Toes natin, sir, is downward po. Then neutral. Tapos papasok naman. Then neutral po. Then papasok po ulit. Then neutral. Then pataas po. And neutral. Okay, sir.
Then repeat these exercises on the other side of the body and encourage the patient to do as many of these exercises by him or herself as possible. And when finished, make sure the patient is comfortable with the side rails up and the bed into the lowest position.
So, sir, okay na po. I-assess ko na po ulit, sir. Sir, comfortable po mo.
So next, remove gloves and any other PPEs if used and perform hand hygiene. And for the evaluation, the expected outcome is met when the patient maintains or improve joint mobility and muscle strength, and muscle atrophy and contractures are prevented. And for the documentations, document the exercise performed and significant observations, and the patient's reaction to the activities. So that's all po. Thank you.